Beautiful people are not always good, but good people are always beautiful because of their good habits and good attitude towards the humanity. Now, Piebaldism. It is a condition characterized by the absence of the mature melanin-forming cells called melanocytes in certain areas of the skin and hair. Melanocytes produce pigment melanin, which contributes to the hair, eye, and the skin color of the human being. The absence of the melanocytes leads to the patches of the skin and hair that are lighter than normal and look like the light color and the white color. 90% of the patients have a white section of the hair near their front hairline, called a white forelock. Triangular shaped depigmented patch on the forehead, the eyelashes, the eyebrows, and the skin under the forelock may also be unpigmented but not necessary. So here one can see the white forelock that was the famous Indian Prime Minister Indira Gandhi, who was well known because of this hair forelock. And piebaldism in an adult and a child, one can see the white patch of the hair on the forehead and also on the hairs. So it is a partial form of albinism. It is a disorder of the melanocyte migration. Piebaldism patients usually have other unpigmented patches of the skin and typically appearing symmetrically on the both sides of the body if they do occur on the other part of the body. There may be spots or patches of the pigmented skin within or around borders of the unpigmented areas. Piebaldism differs from the albinism as the affected cells are able to produce pigment but their function is turned off. Scattered normal pigmented and hypopigmented macules are present. And here one can see also the piebaldism that is extended to the nose and the upper lip. And here it is just the eyelashes are also involved, and these are also giving the color like as on the hair forelock, and the forehead is involved. So there is no great variation in the degree and the pattern of the presentation. It is a rare autosomal dominant disorder of the melanocyte development, means one copy of the altered gene in each cell is sufficient to cause this disorder. Sometimes piebaldism occurs with severe developmental problems, and in Waardenburg syndrome and Hirschsprung's disease, it is unrelated to conditions like vitiligo or poliosis. Although piebaldism may visually appear as partial albinism, but it is a different condition because of the functioning of the melanocyte, which is different here in the piebaldism and different in albinism or these other condition in which there is melanin is lost. So again, one can see the child with piebaldism and the child with the piebaldism with the forehead and the hairs are involved. So autosomal dominant inheritance pattern is there. You just look at the dad has the condition, and here it is the X, that is just non-working gene, and the other is working gene. Here one can see the dad has one working gene and the other is non-working gene, but the mother does not have this condition and she has the two working gene. Now the offspring, if they get the both working gene, one from the father, one from the mother, as one can see, there will be no condition like this seen in these children. Similarly, this child is getting this working gene from father and this working gene from mother, so there is no condition like this. And here, in this condition, the children have the condition of piebaldism because the, this child is getting one non-working gene from the father and the working gene from the mother. So this is going to suffer the problem. And similarly, this child is also going to have the condition because a non-working gene from here and a working gene from the mother is going to contribute with one non-working gene causing the disease, and here again the non-working gene causing. The other thing is one can see the one chromosome with this white absent gene and the normal gene here. And here in this, the mother have one this defective gene with white patch and the normal gene with the blue. Now, the offspring, those who are getting this blue colored dotted gene from the father and this blue colored dotted gene from the mother is not having any kind of piebaldism. But here in this, if the kid is getting one gene which is defective gene with white patch from the father and the other non-defective gene from the mother, so this child is going to have the 50% problem of piebaldism. Now, this kid also having the similar thing, the one white gene from the mother and one blue gene from the father, but again the kid is having this problematic gene, problematic chromosome and supposed to have the problem. But here there is a definite problem because this kid have got one defective chromosome with white patch from the father and one white defective chromosome from the mother. So two defective chromosome and ultimately there is 100% chance of having piebaldism in this kid. This is the safety measure that has been adopted in Indian buses and railway station because the men in India, they always take chance to tease the woman, those who are just in front of them. So the women have got this kind of arrangement and the safety just to avoid the teasing by the men. Now, the etiology of the piebaldism. In piebaldism, vein problems are not present as the eye pigmentation is normal as it is being seen in other depigmented disorders. Piebaldism is seen in all races and every species of the mammals, as the human is also a mammal. Very common in mice, rabbits, dogs, sheep, deer, cattle, and horses. The term piebaldism is not Latin or Greek, but from the English and the French. Pie is the French means magpie, a bird, and the French word has been adopted in English. And the bald comes from the English means lack of or no hair. So the pie, small piece, and baldism, small piece of baldism is the piebaldism. Here one can see the piebaldism seen in the deers. The type 1, they are lacy at white pigment on leg joints, and the other is the pigments that forms rounded spots pigment on the lower legs and type 3 there is white covers extremities, so one can see the piebaldism in the deers at the different types. Human piebaldism is associated with the many endocrine disorders. It is found together with heterochromia of the irises, congenital deafness, or incomplete gastrointestinal tract development, cause of which is premature cutting off a human fetal growth hormone during the gestation. Piebaldism is a kind of neurocrystopathy involving defects of the neural crest cell that include melanocytes. Also involve other tissues derived from the neural crest, oncogenic factors including mistranscription are linked to degree of the phenotypic variation among affected individuals. So here one can see the piebaldism pattern of the hairs, and here it is the forehead which is involved and the hairs are also involved. Continuing the etiology, it is associated with the KIT or SNAI2 gene mutation. The SNAI2 gene, often called SLUG, provides instructions for making a protein called SNAIL2, which is required during embryonic growth for development of the neural crest cells. The SNAIL2 protein have role in the formation and the survival of the melanocytes, and SNAI2 gene mutations cause reduced production of the snail protein, so the piebaldism occurs. Shortage of the SNAIL2 protein disrupt development of the melanocyte in the certain area of the skin and the hair, causing patchy loss of the pigment and the piebaldism. Here one can see the KIT, the normal allele, and here the KIT, the complete deletion of that. So there is functional dimerization and non-production of the receptors, and that function approximately 50% to the mild form. And here again one can see the functional receptors and the non-functional receptors, and the KIT, the normal allele, and KIT, an allele with a missense mutations in the TK domain of the intracellular region. So that is the function approximately 25%, and that is the severe form of the piebaldism which occur because of these defective alleles. Now, neural crest cells migrate from the developing spinal cord to the specific region in the embryo and make many tissues and cell types, including the melanocytes. Apart from the cosmetic reason, this condition has no effect on the health of the patient. As you can see, it is just the cosmetic reason which is just going to have any problem, but there is no problem in the body and any other function of the body. Here one can see that look like a commando or a bandit or a dacoit who is just posing and planning to have a robbery, but actually it is a beautiful flower made by the God Almighty, and see the creation of the God which has given the shape to this, like a man who is looking like a bandit because of the appearance here, but actually it is a God-made beautiful flower. Now, the diagnosis of the piebaldism at birth with the appearance of the patches of the white skin on the arm, legs, stomach, forehead, and a white lock of the hair, which is the hair fall lock. Now, the treatment, depigmented skin in the piebaldism is generally unresponsive to the medical or the light treatment, but the following procedures are used for the temporary relief, that is dermabrasion, a technique where outer layer of a person's skin is removed, split skin grafting, here skin containing pigment is attached to the area affected by a lack of pigment, that is the piebaldism area, mini grafting method, residual leucodermic patches were treated, and additional irradiation with ultraviolet A 10 joule per centimeter square was provided. This new combined approach, grafting plus radiation, led to 95 to 100% repigmentation of the leukoderma. Here one can see the dermabrasion, and this is as it was in the beginning, later on that has led to that. Now the graft which is taken from the patient's healthy skin, and skin is meshed to cover a large wound, and that is the mini graft that is being applied. So skin graft is applied and dermabrasion are the procedure which are used for that. The other treatment is melanocyte and keratinocyte transplantation. Hair cells that create pigment are transplanted to the affected area so that it will start producing the melanocyte and the pigment, and the area will be not having any piebaldism. It is called autologous cell suspension transplantation or autologous punch grafting. Phototherapy used after dermabrasion or cell plantation transplantation to speed up the development of the pigment. And number 7 is RBM, a technique that uses YAG laser surgery grafting. And then the last is makeup. Some people choose it to match surrounding skin tones so beautifully and so skillfully and camouflage the area affected by the piebaldism that no one can recognize that the patient is having any kind of piebaldism. Here one can see the split skin and the melanocytes and keratinocytes. These are just separated and cultured, and these are being used for that. And here the laser is being applied, and here the punch biopsy and the skin grafting is done, and here the beautiful makeup done by this lady to hide that piebaldism. So these are the techniques being used. These are the cell graft, the laser, and skin graft, and camouflage by the makeup. And that is the end of the lecture. I hope and wish that you have liked the lecture, and if you have liked it, please subscribe it, and if you have any question or query, please feel free to contact me, and I will not hesitate to answer any of your question which needs answer. And thank you very much for watching the lecture.